Well, good afternoon, Victoria. As of 2:30 p.m. today, we have 5 new confirmed COVID-19 cases, bringing us to a total count of 137 in Victoria County. This does include the PAM outbreak data. Suspected community transmission is at 34, recovered is at 80, and active is at 54. Our governor's new orders will go into effect Friday at midnight and supersedes all local orders. Our judge and our mayor are present today to speak more about the governor's orders to reopen Texas. We also will hear from our public health authority, Dr. John McNeill, about the continued trends we expect to see related to COVID-19 case counts and quarantine measures that still can and will be enforced when necessary. The city's fire marshal, Tom Legler, also is present to provide and address the 25% occupancy guidelines according to Victoria's fire codes, which will provide more guidance to businesses as they reopen under the governor's new orders. I will now turn it over to Victoria County Judge Ben Zeller.
Thank you, Ashley. Good afternoon, ladies and gentlemen. Thank you for tuning in online. As Ashley mentioned, and as you're all aware, the governor has issued new executive orders that will be going into place on Friday. These new executive orders from the governor largely remove local officials and local decision-making from the picture. Last week, the mayor and I had implemented a well-planned local order that declared all businesses to be essential businesses, provided they adhere to social distancing and sanitation guidelines and had their customer-facing employees wear face coverings. Those were solid steps forward in terms of reopening business and in terms of public health. The reason why I liked that approach and that model is because, and I've said it many times before, I believe that a business's ability to adhere to social distancing and CDC guidance is much more important than whether it's on an arbitrary list of essential businesses. But that belief is a moot point with the governor's newest executive order, which specifically removed our ability to add any businesses to the essential category and specifically removed our ability to require face coverings in any situation. As such, we will allow our local orders to expire tomorrow night as the new executive orders from the state go into effect. We'll also be determining the extent of our continued EOC operations going forward. Even though local officials and local decisions have largely been removed from the picture, the mayor and I want to continue to be as helpful to our residents as possible. And we will continue to operate our hotline for the time being, but it is difficult to interpret an order that we played no part in writing and that is open to interpretation in many instances. Our call center volunteers will likely be referring some specific questions about the governor's order to the governor's office or to the Attorney General's office for clarification and for answers. As Ashley mentioned, the City Fire Marshal's office will be speaking here right after us, and they will also be serving as a resource for local businesses inquiring about occupancy limits. I know that in spite of some differences in the orders that have been in place, we're all striving for the same goal, and at the end of the day want the same thing accomplished. And my hope is that these new executive orders from the governor will be successful in getting the state back up and running, open for business, and in also slowing the spread of COVID-19. A couple items related to county operations. After visiting with Commissioner's Court on Monday and talking with various offices here in the county, we are planning to reopen the courthouse and the courthouse annex to the public on May 11th. So a week from Monday, May 11th, that'll be open to public traffic once again. It may be that not every single office in the courthouse and in the annex is open. Some of those might have a delayed reopening. That, as always with county government, is left up to those individual office holders. But on May 11th, again, we plan to reopen our courthouse and annex to the public. Also on that day, Monday the 11th, we plan to resume our in-person Commissioners Court meetings. We plan to have those over in our Heritage Building right next door. We'll employ social spacing, social distancing guidelines during those meetings, and also have Zoom up and running, so if there's a member of the public who would like to communicate with the court or comment in citizens communication, they'll be able to do so remotely. They won't have to show up in person if they feel more comfortable doing that from home or somewhere else. So those are two new developments with respect to our county operations, and any more details related to that I'll be communicating on our Facebook page and via these press briefings. So I wanted everybody to be aware of those changes that'll be taking place. And with that, I'll turn things over to Mayor McCoy.
Thank you very much, Judge. We're supportive of Governor Abbott's orders and will help to educate and encourage the recommendations he set forth in his latest orders, which take effect Friday. Our local Stay Safe, Reopen Responsibly orders will expire Thursday at 11:59 p.m., as well as the governor's previous orders. And his new orders actually go into effect at 12:01. So you have 2 minutes to do anything you wish on that evening. But we at the local level do not have the authority, as the judge indicated, to make changes under the Texas governor's new orders. Therefore, we will continue to help educate Victoria residents about what his orders recommend to the public as Texas counties and businesses begin to reopen. We want to remain a resource that provides you the information and support you need to comply with his orders. We will reopen our local community in a safe and structured manner, and according to the advice and recommendation of our health experts, including our public health authority, who does have certain powers to make certain orders, and I'm sure he will address that later when he's here, and the public health department, as well as state and local resources. We all care about our community and limiting the spread of COVID-19 in Victoria. So why else would we want to reopen and not comply with his recommendations? We want to do so safely and follow his orders to help us do that. The one point in the governor's report to Open Texas that I want to touch on is special guidance for our more vulnerable populations, which I can say I am part of. And there are guidelines in there specifically for those vulnerable, those over 65 years old and with underlying conditions. And a lot of those recommendations are in this book. So unlike previous orders that look like this from the governor's office, this also accompanies those orders to try to explain them in the various categories, as well as we understand that there's a new updated CISA orders that are now in effect that weren't in effect previously. So there's a lot of literature and a lot of things to look for as we strive to help our community understand and comply with these orders. That being said, our local law enforcement will help educate businesses as they begin to reopen and will continue to rely on the community's compliance. Otherwise, appropriate enforcement action can and will be taken. We want to ensure that we're not just protecting our vulnerable populations, but our entire populations to the extent we can. And I might further mention, the judge indicated in part of our previous orders, we actually mandated the wearing of masks for employees of businesses that were open, and we also strongly recommended everybody else wear a face covering. I continue to recommend that, and I know a lot of people look at that as being mandated as a violation of civil rights and your constitutional rights. But I would ask you to consider other people. If nothing else, if you can wear a face covering and make your fellow citizen feel comfortable while they're out, just out of an act of pure kindness, I see nothing wrong with that. And because we're all in this together, and the more we take actions to keep our community safe, the more quickly that we will be able to reopen our community. So if nothing else, think of other people and your ability to be kind to them and make them feel comfortable in these very trying times. So with that, I'll turn it back over to Ashley.
Thank you, Judge and Mayor. Just a couple reminders. May 11th, the courthouse annex and commissioners' court meetings will open and resume as regularly scheduled. And then, as Mayor was mentioning, the Texans Helping Texans Governor's Report can be found in its entirety online at gov.texas, spelled out .gov. We will now open it up for questions for the judge and the mayor.
Yes, how are we going to be enforcing any violations with the state orders, occupancy orders?
The fire marshal's office, who will be up here right after us, could probably speak a little bit further to that. My understanding is that the city fire marshal's office, will take the lead role in serving as a resource for businesses and restaurants that are inquiring about their occupancy limits. But my understanding as of this morning is that the fire marshal's office will be the point agency in being a resource for that.
Will sheriff's deputies and police officers be assisting them?
I think to a lesser degree, the fire marshal's office with them. Well, I'll let the fire marshal speak further to that, but I think all of our law enforcement agencies, their effort would be as a resource for the residents and the businesses who we know are going to have a lot of questions.
And to add to that, I think from the very first orders we ever put in force, Judge, our law enforcement officers created a task force, and their primary mission was to go out and educate people as to what they mean. And I think that would probably be the tack that they would choose to take. It's their responsibility to enforce the laws as they see them. But I think the history in Victoria has been, I think at one time there were 400 and something businesses that were initially visited, and then it went up to something like 600. So they will react to the situation, and I think it'll be a matter of educating and encouraging our citizens to do what should be done.
That being said, are there penalties and punishments that could be handed down for violating these?
There could
I
be.
believe there could be.
One thing, though, is that a lot of the governor's executive order is not phrased in terms of a mandate. It's phrased in terms of what people should do, which is a distinction between the areas where it says people shall do things. So a lot of the new executive order is not a mandate, it's a suggestion. So that would certainly be a distinction in any enforcement conversation. But again, the approach locally will be in terms of being an informational resource as a primary objective.
But to answer your question specifically, in his order, it does state that there can be a fine not to exceed $1,000 and a jail term not to exceed 180 days, which was consistent with the type of deal. Now, the implementation of that, we'll leave that up to law enforcement. Okay.
Any other questions? Sure.
Are you worried at all about a potential second large outbreak? How do you guys feel about the potential for other rounds?
I think Dr. McNeill could speak better to that. He'll be up here right after us. I know most everything that we see and hear and read suggests that COVID-19 will be something that stays with us for a while, that we'll continue to see cases of that, and that it'll be with us. As far as the severity of that, I think Dr. McNeill could speak better to that from the medical standpoint.
Question about masks and requiring people to. Why not impose a local order requiring residents to wear a mask in public, as we've seen in the city of Goliad or Harris County?
Well, I guess the answer at this point is that because legally we cannot. With the governor's newest executive order, local jurisdictions are specifically prohibited from doing that. But of course, like we talked about in our prior local order, the mayor and I felt it was prudent and appropriate and legal to require that employees of businesses that have direct contact with the customer do wear a mask. That was a requirement we had in place. That's no longer a requirement, but it is continues to be our suggestion.
I guess an analogy to that would be if, for health reasons, you go into a food establishment and there's a requirement to wear a hairnet when preparing food, wear gloves and things like that as a health issue, it would seem logical that you could have an employee, do the same thing. An employee, but a general customer, I don't think I've ever seen a place where a customer was required to wear a hairnet and things like that. So there were constitutional challenges to the notion of mandating these, and I think that's has been the dilemma in this all along.
The prohibition is for governmental entities.
Right.
Any business owner can still require that people coming into their business
Absolutely.
wear a shirt and a face mask if that's what they do. In the governor's order, it was addressing local governmental entities. We can't require that. Ingrid, you had one more?
I just wanted to ask, was there anything in that order that you guys saw from the governor that you guys were surprised to see?
Not really. I mean, the phased-in approach is something that everybody's been talking about. The timeline and the percentages was anybody's guess up until now, so guess I'm not really surprised by much. I, of course, would have preferred a little more local discretion. I think we know our community and our needs and circumstances better than anybody, but that's the governor's prerogative, and my hope is that this order will be successful and we can return to normal as soon as possible.
We have time for maybe one or two more questions.
With the state order superseding our local orders, do we anticipate any businesses or facilities having to close?
That could be the case. I have not heard of specific businesses that were allowed to open under our prior order, but now are forced to close. They could be out there in the past. Since Monday, I haven't heard directly from them, but that could be the case. Off the top of my head, I don't know what that would be, but clearly it was our goal to enable any business that effectively social distance and had employees wear a mask to be able to operate. With the governor's executive order now in place, it could be that some have to close.
And that being said, if I'm a local business owner, how can I get clarification on the nuances?
We'll continue running our hotline. However, for those specific questions, the governor's office or the attorney general's office would be the one that could give you a legally valuable answer. We help to the extent we can, but again, we didn't locally play any part in writing those orders. We're just trying to help folks as much as possible. So for the difficult, specific questions, the governor's office or the attorney general's office.
Right. And that will be our, many of the things that come to us in the form of questions, which we're glad to answer, will probably be redirection to the specific entities within the state government who can answer those questions.
Right.
So that's the best we can offer.
We do have 2 others coming in, so to be mindful of theirs and our viewers' time, if no one else has any other questions, I'm going to allow Judge and Mayor to exit the room at this time.
you.
Thank you again for your time and for your answers. Thank you for your questions. For more information about the governor's report that both Mayor and Judge were just speaking about, as well as his executive orders, visit the Office of the Texas Governor's website at gov.texas, spelled out, .gov. The hotline number, if you have any other questions, as Mayor was referencing, you can call 361-580-5796. As was discussed, the governor's new executive order will go into effect midnight Friday, 12:01 to be exact. If you have additional questions, once again, our hotline can point you in the right direction to view and access that report online. Next, we will hear from our Public Health Authority, Dr. John McNeill, and our Fire Marshal is here today with us, Tom Legler. So I will now turn it over to Dr. McNeill.
Thank you, Ashley. Good afternoon. I just have a few things. Let me go over the case counts first. Again, we always do that. New cases, as you know, are 5, bringing our total cases in Victoria County to 137. Of those, 34 are suspected community transmission, and y'all know we watch that very closely. Our recovered patients, I'm happy to say, are up to 80. So 80 of these patients have been recovered as per CDC standards. In other words, they've met the criteria to where hopefully they're no longer able to transmit the disease, and they've done well. We have, that brings us to a total active case count of 54. So, now as we continue to reopen Texas under Governor Abbott's new orders, and I have a copy of those new orders, and I have some things that I'm going to go over today they wanted me to go to review. It's going to be kind of a review of some of the things we've already talked about. But I want you to know that we are increasing testing as well. And along with that is going to come the expected finding of more new cases. So when you see the case count go up, and I looked at our case count today since the first day when we announced that we had 3 cases, which was, I think, on the 15th of March or somewhere around there. But ever since then, it's gone continuously up, and it's been a steady increasing rate. And so we'll just keep watching that. We'll keep watching those numbers, and we'll keep doing it. We hope that eventually we'll get to a point where we reach that peak and start going down. I will tell you nationally, though, they've looked at that, and remember that further north in New York and some of the other areas, they're ahead of us in this disease. And one of the things that we're finding with this disease, because we're finding new things all the time, is that while we thought we would go to a peak and come right back down, the peak seems to be sustained. And that goes along with this illness and the transmission of this illness and the ease with which it is transmitted from human to human. So we'll keep watching that. Hopefully ours will go up and go straight down. We're ready for a peak. Now, businesses should abide by the governor's new minimum standard health protocols. And I have some of that information here, and I'm going to go through it with you. Now, we have in there these orders actually, before the mayor, I saw he showed you a thing that before we got the orders, and they were a couple of pages, a few pages, and a lot of legal stuff on it. But now we have a little book that actually explains a lot of this, and I've read it, and I've read a lot of it, and it really makes a lot of sense, and I advise everyone to go online. Actually, where do we have that online? Do we have it?
We have it on our victoriatxoem.org website, as well as the governor's, like I said, gov.texas, spelled out .gov.
Okay, so it's easily accessible, and that way we can get that information out there. Now, they have the minimum standard health protocols is what they're calling it, and they have checklists for individuals, and they have checklists for employers, and they're both very important. So a lot of it's the same stuff. Now, it's all predicated on the fact, though, is that the virus that causes COVID-19, we know can be spread basically with no symptoms. In other words, it can go to individual with no symptoms. So that changes everything, and that's information that we didn't have a month or a month and a half ago. So we're going to watch that closely. And these health protocols for individuals, remember the maintaining 6 feet. Social distancing is still very important. We need the 6 feet. So we still recommend masks, and I heard what the mayor said. While it's not necessarily a mandate, it's not something we can make you do, it's not something that we require you to do, but it certainly is something that we ask you to do. I'm telling you that when I go somewhere and I see people without masks, I don't really like it. I don't feel as comfortable as I would if everybody were wearing a mask. Remember, you're protecting yourself with other people protecting themselves, and then protecting them from you as well. So it's just a good idea to wear a mask. They're easy to do, and I say mask, but I think y'all know by now that I mean facial coverings because I interchangeably use the terms. So remember to keep looking for the symptoms, and as an individual, you need to screen yourself, folks. And remember, just earlier this week, the CDC added some new symptoms of COVID, and these are the things that really came out, and we talked about those at the last press conference. We'd said that these things came out because we started seeing them. Who would have thought that losing your ability to taste or smell would be a sign of this disease or a symptom of this disease? But it is. So that's a symptom that is now listed on our things to look for. We've always known that this is a viral infection. We've always known that you will feel viral, for lack of a better term. And we've also had viral illnesses before, like the flu, where you feel cruddy, you have low-grade fever, or maybe even higher fever. You feel bad, your muscles ache, and things like this. I remember when I caught the flu one time, it started off with just muscle pain in my legs. And I thought, wow, I've been climbing a bunch of stairs, and I simply remembered that I'm an elevator person and that I wasn't climbing stairs. So that's what it was. It was the flu. So things like that, muscle aches, muscle pains, and things that bother you, these are symptoms we look for. So what the main thing that they're saying on these minimum health standards is to look for these things. Look for chills, look for headaches, look for things out of the ordinary that make you feel bad. And then consider yourself possibly infected and get tested and get checked if you need to. So remember to wash and disinfect your hands. We can't say that enough. We have to say it all the time. This is the part of on these standards here. They talk about, consistent with the actions of what the people in the state are saying, is that we need to wear masks or facial coverings. So they mention that in there as well. The next part that I want to tell you about is a checklist for employers. So all this data is easily available. And basically they want you to make sure that you train your employees about how to properly clean and disinfect the business or the business that you're in. Hand hygiene, respiratory etiquette is what they're calling it now, respiratory etiquette. I guess we've always had that around. Simply stated, cover your mouth when you cough or sneeze. So remember, for shortness of breath, watch for all these symptoms that can happen. So they go through the symptoms again, and they basically want you to screen your employees for these symptoms. So we've got to watch out for these symptoms. Remember, folks, this whole deal is about not giving this virus an opportunity to spread, because it spreads into what we call a reservoir. And you become a reservoir when you hold this. The larger the reservoir, the larger amount of virus that we're going to have. So be careful with that. We want to limit the reservoir by limiting the virus's ability to spread to other humans. So do not allow any employees to work if they're sick. That sounds kind of crazy, but we need to say it. So if they're sick, they need to go home. They need to isolate. And we have strict standards and the CDC has standards about when they can come back. And we've mentioned those before. When the symptoms are gone and when they've been afebrile or no fever for 3 days without any febrile medicines such as Tylenol and Motrin. And also, as long as, and of course, if you don't have any other symptoms like cough or shortness of breath, and remember, it has to be at least 7 days from the onset of the symptoms. Those are all CDC guidelines, and they're listed in this information as well. So there's a lot of stuff in there that tells you that I can tell you that I'm familiar with these. I've looked at it from the restaurant standpoint. And at my restaurant, for lack of a better way of saying it, we're going to follow these things. We're going to go by the numbers, and Mr. Legler here is going to talk about that in just a few minutes from the fire marshal's office, and he'll tell us about those standards and what we're going to watch for. So basically, what we're talking about here is just a way of getting this information out to people so that you can be safe yourself, and if you're an employer, you can keep your employees safe. The whole idea is for us to be able to reopen, for us to be able to get out and do things slowly and safely. And I agree with these plans. I agree that they're safe if we follow the rules. And the rules are, to me, to wear a mask. Their recommendations on this, they're rules to me. I think everyone ought to wear a mask, and I say that in our facial covering. I say that all the time. So, that being said, there's a couple other things on here I need to talk about. Wow, they said to mention facial covering. I've already done that one. Okay. Now, remember that this has come up, and I'll mention this again, and the businesses have been asking on the hotline if they're required to wear facial coverings. And he's already explained that the governor's mandates have come out, and they will basically negate our local mandates, and that's fine. But that doesn't mean that it's still not a good idea. When I go to a business, I want to see people, especially that have face-to-face contact, and I'm talking about drive-throughs. I'm talking about those things, and I think that's important because, once again, we're trying to slow the spread of this illness. The last thing I want you to know is that, on a serious note, I want to reassure you that as your public health authority, that we're still going to make sure that the public safety and the public health is our number one goal, okay? No matter what the rules are, no matter what. To put it bluntly, the governor's mandates don't affect the local health authority's ability to control this disease. So if it gets to a point where it's out of control, the local health authority can quarantine people. We can detain people even if we have to. We can put orders on them to where they can't leave their home. We've only had to do that once, and I'll tell you that. We've only had to do it once, and it was in another county. So, but those are things that are out there, and we don't want to do anything like that, and it's not anything that we wish would ever happen. But I want you to know that I take these things very seriously, and I want you to know that your health and that the health of our people is the most important thing that we're up here for. And everything we do is based on that, and everything we do is a collaborative effort. Okay. And I think I'll be able to answer questions here in a few minutes. Thank you,
Sure.
Ashley.
Thank you, Dr. McNeill. Tom?
Thank you so much. We've been receiving several questions, lots of questions actually, about how businesses should reopen following Governor Abbott's executive order to reopen with the 25% of their capacity. Our first goal is to educate the establishments about these guidelines. And thereafter, appropriate enforcement action could be determined by my office, the Fire Marshal's office. If you have an occupant load certificate from the City of Victoria's Development Services, you can use that number to calculate your 25% capacity. Not all businesses have that certificate, so therefore you can there are several different ways you can calculate that. We have a form or a letter that's posted on the victoriatxoem.org that includes different tables as far as how to calculate that. There's different ways we can do that, and we can help you out as well. Calculations used in this table are to comply with Governor Abbott's executive order. They are not designed for official fire and life safety practices or purposes. The City and Fire Marshal's Office reserve the right to modify the occupant load in accordance with the adopted building and fire codes. For an example, restaurant dining rooms are considered unconcentrated assembly areas. Their occupant load for dining areas is usually 15 square feet per person, and booths are fixed seating, calculated at one person for 24 inches of booth space. So knowing the square footage of each area of your restaurant, you can determine and calculate what your designated occupant load is. If you do not know your square footage, you can go through Victoria Central Appraisal District's website, and they have that information for most businesses as far as the square footage. And their website is victoriacad.org. In our letter or our guideline for this, we talk about assembly occupancies, including museums and gallery spaces, different assembly occupancies such as the restaurants, also with churches, business areas, courtrooms. I know they said that the courtrooms were opening up as well, potentially. Commercial kitchens. Commercial kitchen space is designated at 200 square foot per person. So it's different from your dining space. Libraries, including the different reading rooms and stack areas. Also mercantile, and that's the retail space. And then there's a different calculation for the stock space behind, which would be your warehouse or your storage area. If you need additional help, you can go to the victoriatxoem.org website, and this form will be on there, and also has information on how to contact the Fire Marshal's office to help you with calculations if it's above and beyond what you're able to. I know the Victoria Central Appraisal District does not necessarily have square footage for churches, so that's always a challenge to calculate that, so we can help you out with that as well. Again, these are designed to help you comply with Governor Abbott's executive order, and like I said, the Victoria Fire Marshal's Office can definitely help you out with identifying those numbers.
Thank you, Dr. McNeill and Tom. At this time, we will open it up for questions.
Tom, could you give us the phone number that you specifically would want citizens to call if they were calling on the Victoria Fire Marshal's office?
Yes, it's going to be 485-3460.
They also can call the COVID hotline, which
Yes,
again is
ma'am.
580-5796.
You had a preference
Yes.
for what phone number?
With regard to enforcement and education, is that going to be like are you going to be doing that like proactively or reactively? Like, are you going to be sending your staff into the community to check on businesses, or are you going to wait to hear about violations?
Since we don't know what type of reaction the community is going to have with the restaurants opening, we will probably at least visit and drive by locations just to see what type of response the community has, because we really don't know if people are going to be lining up at the doors or people are going to take the time and wait a couple weeks. So we don't know. So we will monitor it and just see where we are, because it's such an unknown.
And piggybacking on that, I know your office already has numerous duties like investigating fires and enforcing fire codes and ensuring safety. Are you going to be asking for help in educating and enforcement from sheriff's office, police department, county fire marshal's office, building inspectors?
All that is a potential. Again, not knowing exactly what we're walking into as far as what type of work demand is out there, what type of response the community is going to have to the restaurants and retail opening. But we'll definitely monitor and engage where we are as far as the workload and if we need to bring in additional help. I know development services with code enforcement and the building inspectors have already offered to help as well.
Do you want residents to report infractions to you?
If they see something that's a violation, I believe that that's something that does need to be reported.
And would love to hear a little bit more clarification about when your office might hand down a penalty rather than a warning or an education.
Again, that because it's an unknown and we're walking into a situation we've never dealt with before, we can't concrete say at this point. It just depends on how the response is of the business as well. So there's a lot of what ifs that could be done.
Ingrid, did you have a question?
What would you like to see business owners doing at this point as they're reopening?
We've had multiple business owners have already contacted us and asked for help on their occupant loads and understanding. We've talked to some businesses and some restaurants that have decided that they are not going to open under this restriction, and they're going to wait till they get a higher occupant load. We're hoping people reach out and ask for help, and we want to see the businesses open and open safely. And so we hope to see that reach out and assistance.
Can business owners disallow a customer who looks sick from entering their business? And should they?
As far as I know, business owners can refuse service to anyone. I know there's a lot of businesses that have that sign posted somewhere, and this may be an opportunity where they may actually enforce that, whether it's over face coverings or if somebody does not look well, and to protect their employees and their business.
The governor's minimum standard health protocols do address for their facilities what businesses can do to address that. And it says to please place readily visible signage at the business to remind everyone of best hygiene practices. And so that is something they can safeguard upon entry into their building. Sure.
I have a question for you, Dr. McNeill. So I got a interesting alert today from a business that said we are now providing COVID antibody tests. What are those, and do you think that they're valid?
Well, that's a good question, because there's a lot of controversy concerning those IgG and IgM tests that you're talking about. That has to do, and we've talked about this before, it has to do with immunity after you've had the disease. And there are a lot of people that think that they've had COVID in the past because they were quite ill and before we had COVID testing available. So the hope is that after you've had this disease that you will be immune from getting it again. But that's where the jury is still out. We don't have that information. We don't know. I've said this before, but the other coronaviruses, the ones that cause the common cold, will typically confer immunity that lasts about 45 weeks from our experience with this. We don't have that experience with COVID-19, so we don't know. They think that it will confer some immunity, but we don't know, one, if it will, two, and how long it's going to last. It could be anywhere from a week to a lifetime. So getting the IgG and IgM testing may be interesting at this time, and it will tell you if you've been exposed to the disease because you have built antibodies to it. The other side to that is that once you're exposed, it still takes a few days to up to a week, I'm told, depending on which source you read, it takes a little while to even develop the antibodies in your blood. So you could have already been exposed recently to the disease, have a negative IgG and IgM test, but then still be COVID positive. So there's a lot of controversy out there. There's a lot of things. The last I had heard, there were 60 different manufacturers or people that were selling these things and doing these things and providing them for the public. And it's my understanding that through the emergency use protocols from the FDA that they have not had to go through the rigorous testing. And so these tests may not be in other words, one test may not be as accurate as another. So it's new science to this because it's a new disease. The science is not new. We've known about IgG and IgM forever, or for a long time. But the immunology experts are very cautious right now as to what our knowledge base is on this because we don't have the experience with COVID-19.
We have time for one more question. Sure.
Dr. McNeill, you said that we are going to be increasing testing. How are we going to be increasing testing, and why and when?
Well, when I say increasing testing, we're increasing testing across the United States. They're ramping this up by the millions. So that's what I meant by that. As far as locally, I know there are tests available locally right now. Anybody can get tested right now if they really need to be. So, and we hope to keep it that way.
Right, and the testing facility list is available at victoriatxoem.org in case you're wondering where you can get tested. At this time, we'll go ahead and wrap it up. Thank you both for your time, and media for your time, viewers, yours as well. Just want to remind you that the minimum standard health protocols checklist for individuals and for all employers as you begin to reopen Texas is available online. Dr. McNeill was able to kind of touch base on some of them, but to go into detail, it really is beneficial for you to access that online, and that's gov.texas, spelled out, .gov. Once again, case count reminders, Victoria County has 5 new cases as of today, bringing us a total cumulative case count of 137, and that does include the PAM outbreak. So we will update our website and our social media pages at the end of today, likely about 5 to 6 p.m. with any additional case counts. And the next press briefing will be this Friday. In the meantime, if you have any other questions, you can contact COVID Hotline, or you can visit our website at victoriatxoem.org. Thank you so much for your time.